The Nurturing Care for ECD program is actually, we are the implementer for the Eastern African region, from Zambia to Ethiopia, Tanzania to Mozambique. We are actually the ones who are implementing it. This program was actually, it was launched back in Harvard, where His Excellency the Governor himself went there, made a visit with the team from the county, and actually this baton of the nurturing care was handed over to him, and then he promised to come back to Siaya County and implement it for also all the neighboring counties. So we are actually the county modeling it for Siaya, and for Kenya as a whole, and for the whole of the Eastern African region. Initially, back in 2014, according to the Kenya Demographic Health Survey, it was found that there was high level of malnutrition. Issues like malnutrition, we call it stunting growth, low birth weight, were very prominent because of probably issues to do with nutrition, poor visits to the health medical attention, and then poor, we call it responsive caregiving. It was not up to date. So when now the Nurturing Care program came with the 5 elements, that is good health care, good nutrition, security and safety, responsive caregiving, and opportunity for early learning. Now we are seeing that from the campaign that we have been doing, the parental engagement, the so many workshops, and then the which we have been doing in a multi-sectoral nature, whereby we involve every sector from the devolved to non-devolved. We are moving together as a unit in ensuring that this program is implemented.
Siaya County has about 1,000 ECD centers. Now our ECD centers are vast across the county. We have both private ECD centers and we have public ECD centers. Of the 1,041 ECD centers, we have 684 ECD centers that are public. When we come to ECD, we don't look at the education itself, because at this point I am talking about early childhood development in terms of learning, which is the 4-year-old to the 6-year-old. However, when we look at ECD, we look at it as holistic as it can be. A child's development starts from conception to 8 years old. This is the place where the brain of the child develops, and the way the brain will develop will affect the way the child is going to grow up in the future. Now, your child should be looked at in those eyes, because your child is your future. How do you take care of your future? You protect it. So those are the strategies that have been laid out under Nyathi and Mwandu, so that this child will be brought up in a holistic kind of way.
Nyathi and Mwandu is the rallying call. It's in Doluo. That means a child is wealth. If you give that child a good foundation, that child is wealth. And so, being the patron of Smart Start Siaya, I've been a patron for 2 years, following realization and the introduction from the county executives who went to Harvard University for a program on early childhood development. And from Harvard University, when they came back, they realized that early childhood development is very critical in development. And if we invest more on early childhood, then the return on investment is very high. And so we realize that mostly, even us as parents, governments, we don't really take much interest when our children are young. And so we lose a lot, because that is the time a child develops very fast, the brain of the child develops very fast.
This project of Score ECD is looking at a child at 1,000 days. 1,000 days means from conception to 2 years. And we look at many things around this 1,000 days. We are looking at the health of the mother during pregnancy and after pregnancy, and then during the 2 years, how is the mother? Then we are also journeying with the child and assessing the milestones of the child. The milestone of the child, we are looking at so many things, health-wise, nutrition, education, the formation of the brain, how does the child react to the environment. Along that, we are also looking at the immunization of the child. How is the child's health going to be taken care of within the 2 years? The child has to go through all the immunization, and this helps the child to remain healthy.
Male partners, we really train them to say that a mother cannot raise a child alone. They have to be two. So there's that responsibility of a father in the house. So fathers, we see them coming to the clinic. They bring their wives to the clinic, their children to the clinic. Whether the mother is pregnant or not pregnant, they come with the mother in the clinic. So it's a habit that they have really developed, and they are coming frequently for that, and they feel it's just too good for them. If a father is not able to escort the mother to the clinic, a father will provide transport. And the father also is taking a responsibility of reminding the mother, your time has reached. Did you go to the clinic? And then when it comes to nutrition also we try telling them and also training them to provide. That is by initiating the kitchen garden around them.
Uzuri nilikuwa nafundishwa hizi vitu na naenda kuambia babake. At first alikuwa anaona ngumu. Sa the more niliendelea kumwambia ndiye akaanza kupractice. Na the difference is there. I've learned things that all things is not about money. How can I find a balance there? They introduce us to kitchen garden. So the kitchen garden unaeka sukuma wiki, spinach, even kunde, such things. So the little money you have, even if it is 50 shillings, you can go and buy your mena. Then you take sukuma from the shamba. Then you cook with ugali. So the child has that balanced diet. Kuna ugali, which is carbohydrates. Kuna sukuma, which is the vitamins. Na kuna omena, which is the protein.
I have learned that upbringing of a child should not be left to a woman alone. For you to have your children growing the right way, on the positive direction, the child that gets everything that you need in life, you, the man and the wife, must work together. Now, as a man, what should I do? I should provide to the children. I should help my wife to perform the domestic chores, like cleaning the child should not be left to the woman alone. I also play with my children when I'm around. Play is something very important in that we learn that when you play with the child tends to know you better. The child psychomotor system of it can grow. The child comes out when he or she is a very strong person. Intellectual development can also be realized when you play with your child. And during play, we don't need to go to the shop to buy the play materials. We make them with the local available materials. We improvise. We find that it is very expensive, and the money that we will use to buy some other things that we use in the house, we waste them in buying these items. Why don't we use the local available materials to make dolls like this? We have made so many of them, and while you are making, you find that the child also enjoys following what you are doing.
We have so many materials. You can see we have hung others around. We have a play box, which we make rockery, that we provide every morning. Once a child gets in, he is free to pick. We ask the mother to pick the toys and try to engage with CHVs again to play with them around. We train them that we are supposed also to make toys to our young ones at home, and this chart There is some days we had so many charts that we were able even to give to the communities, household communities, that they can able also to monitor those ECD activities at the household. ECD activities which are being promoted by that organization, that is BATH, it has encouraged many mothers to come to our facility because they guide us what we are supposed to do. They have taken us to courses, some trainings, and their routine. They come to this facility routinely to check how ECD activities are being going on. These activities of ECD starts from the community. They have also trained our CHVs on ECD activities. They can also able to refer to us, the hospital, also in CH department, whereby we examine the child according to developmental milestone. Then we refer accordingly if the child has not achieved according to the age.
Sasa wakina mama huwa tunawatembelea, ni wewe mwenyewe ujipange. Kama mimi mwenyewe najipanga at least in a month mama namtembelea mara 2 mara 3. Sasa vile ninaenda na book appointment, manake wajua wako na kazi wanafanya. Hiyo tarehe ambayo amekuja na prepare topic ambayo tunaenda kuongea naye. Tuko na 17 topics ambazo tunacover. Kuna introduction to child caregiving, kuna secure attachment, kuna child development, kuna the importance of play, appropriate play for children and caregivers, inclusive caregiving, making toys from local materials, kuna under communication, kuna the importance of communication, play and responsive caregiving. Under health, kuna safe pregnancy and delivery, kuna basic newborn and young child health, kuna malaria awareness, HIV and AIDS awareness. Under nutrition, tunaongea about breastfeeding and complementary feeding, balanced diet. Under protection, tunaongea about safe home environment and wash. Alafu topic ya mwisho ni positive discipline.
Things like malnutrition has gone down, stunting has gone down, child mortality rate has gone down, the issues like mobility and the rest have gone down. Right now, a number of mothers are now delivering in health centers. Before this program came, actually a number of them were being catered for by their midwives, which was actually leading to a lot of child deaths.
Nikiwa pregnant, nilikuwa nafunzwa jinsi ya kuongea na mtoto. Unashika tumbo lako, unasikia penye akilalia huku, yani utasikia mtoto akicheza, mtoto saa zile kwa tumbo anajua sauti ya baba au ya mama. Saa zile baba anaguza tumbo yako, anajua. Pia alikuwa na kiss tumbo yangu, na sasa pia mama anasikia vizuri, mtoto pia anasikia vizuri. Mtoto hakuwa na ugonjwa yote vile nilimzaa. Mtoto alikuwa active sana.
What we first did was to bring partners together, all partners who are working with children, and also departments that are relevant in children's growth and development, and that is health department, education department, agriculture department, and also in areas of lands and roads. And maybe you'll ask me why at some particular point in time, but we realize that a child really some of the planning and even the programs that we have, the way we plan our cities, these days most of the playgrounds were grabbed. We don't have spaces for children to play, even when we are planning buildings and areas, we don't think of children. Even in schools, when you have nursery schools, you find that a toilet for children is taken very far away, and a young child, when wants to go to the toilet, goes when he or she is very pressed at that particular point in time. How do we really take cognizance that when we are planning, because these are voiceless children, they cannot voice that we want this. Youth can say we want this, women, yes, and we concentrate more of our finances on women and youth, and we forget our children.
We are trying as a county to recruit more ECD teachers. We are trying as a county to capacity build the caregivers, That's also another challenge where we are in. Our partners are really helping us, especially on the part of capacity building for caregivers, in the line that early childhood is a transitional phase. 0 to 3 years, you find that most of the working parents have children who are 2 to 3 years, and they have to go back to work. So they have to give these children to a caregiver. Caregiver is in the child care centers. Once you notice that a caregiver has been built their capacity, that means you're sure the vaccinations of the children has been done. That means you're sure the growth of the child has been measured. That means you're sure this child who's transitioning from 3 years to ECD center now at 4 years is a child who is simply being monitored, has been dewormed from the very beginning. So by the time they come to the ECD center, the teachers, the instructors in the ECD centers are ready for this child. They're able to handle the cognitive development of the child. They're able to handle the curriculum that is in place, and they're able to nurture this child for the next phase.
The county government have provided us with classes. We have desks and chairs. After we have been trained, so we come to the ground. Then we can ask children to bring this locally available material. Then we can make some project with them. As an ECD teacher, we value our learners very much. So when they are here in school, we teach them more about good behavior, good manners, and how to relate to others.
If science says that early childhood is critical, 80% of brain development occurs from 0 to 3 years, then the 20% really it's just what takes on in environment. And if you can imagine, if we lose that 80%, we are not saving the brains of our children.
As much as we are putting in place the structures, we would like community to accept that these are our children, and so that they don't hide the children at home. Now, why do I talk about this? I talk about this in the line of the persons with disability. Children who have who have disability in one way or another, the parents feel like they lack something. They could feel, one, they're stigmatized. Two, they really don't have the capacity to be able to take this child to school. So they lock them in their houses. So this becomes a challenge for the county to be able to bring up these children in a universal way.
One of the loopholes in the sub-county, and the counties and the national government, is like you realize that when you want to sign a policy, it cannot be signed at the county level. It needs to be signed at a national level. And sometimes it's like people do not understand when you talk about that we have these children under 1,000 days, and we need to put a policy in place that will help them. It will take you time to explain, and you'll move with those officers several times at the national level. At the county level, it becomes easy because it's almost at the grassroots. People need to be brought to read on the same script. Who are these children under 1,000 days? Can people understand? If I say we are taking care of the children over 1,000 days, what is included in these children?
The only way we can create enabling environment for research in ECD is ensuring that there are resources.
When we get resources at the national county offices, it is not very easy for these resources to trickle down.
The county's reps should be fully enjoined in the development of these policies. Any policy being developed, whether it is in agriculture, whether it is in education, it should involve representative from the county level.
ECD is a multi-sectoral issue and has to be looked at as multi-sectoral. Where do they get their water? Where do they get their food? Where do they get their health requirements? It has to be multi-sectoral.
The government to take cognizance. Those officers who are working, doing planning and budgeting, to realize that when they are budgeting and doing anything, they think of children. And so we are also trying, when we go out to the community, is to help them create demand, so that they demand for these services.
Now we need to go to the next level. The next level is to identify the gaps that are in each school, so that you know that the school that you have identified, it really is not just masks and sanitary towels and sanitizers. It is now deeper, and deeper means now we need to know how to support them in other small issues that they need support in.
This conference is a unique opportunity that happens once every 2 years, in which a large number of Kenyans and international participants from all areas, all stakeholders, will be coming together in order to discuss these extremely important issues. These issues have been have become even more important in the context of COVID-19. So this fourth international conference, which is taking place 19 months into the COVID-19 outbreak, with all of the lessons learned from the COVID-19 outbreak, is an opportunity to share those learnings, to make sure that everybody are aware regarding the importance of ECD. ECD is a relatively new area of work in many countries, which until recently did not enjoy the same level of knowledge and awareness and publicity as many other areas in public health. It is now that we are learning with experiences from many countries, and Kenya included, regarding the importance of nurturing care framework, the importance of early childhood development, and that is a time for all of us to come together and to make sure that we really prioritize those nurturing care framework investments in order to ensure that Kenyan children get the best in line with all of the international standards, to make sure that they succeed in life, that they fulfill their potential, and that themselves as individuals, their families, their communities, and the country as a whole benefits from those interventions.
This year's conference is important because we are focusing on the children who are below 3 years, with a special focus on their caregiving, because in Kenya you will realize that when it comes to legal and policy framework, we do not have guidelines that are showing how we should look after the very young children, especially for those mothers who are working and where they leave their children. And it is an opportunity for us also to explore children in diverse circumstances, including those in the refugee camps, those who are accompanying their mothers to prisons. They have not done any crime, but they are accompanying their mothers because they are young and they cannot be left in the community. All this will be discussed during the conference, and we anticipate to come up with resolutions that will enable our government come up with policies around these children and even legal frameworks that can protect these children in society.